Hello, everyone. Today we have Professor S. Venkat with us. And since he's with us, we will be talking about digital health, the hot shot topic today. So, Professor Venkat, how are you today?
I'm doing fine.
So, since Professor Venkat is with us, we'll talk about digital health, which is the very hot shot topic nowadays. So, Professor Venkat, how are you today?
I'm doing fine, Himanshu. Thank you for your invitation to interact through this podcast.
Sir, who else could I ask for apart from you?
Yeah, thank you for your words.
So, since we have the expert with us himself, we'll definitely talk about digital health, how it is going in India, how is it evolving, who are the players, each and everything, the innovations, the technology, and we will be getting good answers to that, so you people can create or can make notes of it and could use them. So, first of all, Professor Venkat, the primary question which I want to ask you is for our audience, what is digital health and how it is evolving in India?
Okay. See, this digital health is nothing but how do you connect the old information with the current through technology. For example, you are visiting a doctor.
Right.
Many people they don't maintain their health records or the prescription when they go to a doctor first time. When when they revisit the doctor, they miss the prescription and diagnosis and everything.
Mhm.
So this becomes very difficult, and the doctor becomes clueless how what treatment has been given for what problem that patient has come, etc.
Mhm.
So basically, it started with creating records of the patients, which will facilitate a better diagnosis or a better treatment on the repeat visits by the patients to the doctor or a hospital.
Okay.
Some of the hospitals they maintain, but they maintain in a hard copies form,
Mhm.
and it is very difficult to retrieve. So the entire world is moving from physical world to cyber or cyber physical world, wherein you take the help of digital technologies in retrieving the information or using the existing or past information
Mhm.
whenever there is a necessity for either medical or non-medical or even any other case like that. So for example, now you have a mobile wallet.
Right.
Like that, when you go to a health expert for seeking health, that health expert may be able to retrieve your records in real time.
Right.
So like that, there are a number of such technologies available, and I would say maintaining your health information in electronic form is one part of the digital health.
Right.
And the digital health is much more, but one element of digital health is uh, providing or keeping track of the information about the patient,
Right.
about their health.
Right.
Yes.
So that is the primary thing one should talk about.
Primary purpose of digital health, or according to me, digital health means one of the benefits or one of the fundamental uses of digital health is using the digital technologies or digital platforms as to uh, keep the information about the patient, which can be used on repeat treatments and for every other future purpose.
Mhm.
Yeah.
So, sir, like since you're talking about this, can this digital health, right? So, can this basically remove the difference in the healthcare at the bottom of the pyramid? How this can create a difference, or whether it can create a difference should be my question,
Okay.
right? But if yes, then how it can?
Okay. Good. As you are aware that the penetration of mobile phones or mobile technologies in this country, particularly in India, is one of the highest in the world.
Right.
And with the advent of smartphones and smart technologies, the adoption of smartphones in Indian context is again one of the highest in the world.
Right.
So by use of these mobile technologies or smart technologies, many people from the rural or semi-urban background, even including urban background,
Mhm.
they are able to uh, reach to the service providers or healthcare providers much faster. And
Mhm.
today, if you see during COVID time, and both rural and urban population was able to get connected to the doctors seamlessly or healthcare professionals seamlessly, including some of the other healthcare services. For example, people can place order for their medical tests and even door delivery of medicines and so on and so forth. So there is a huge benefit both for the urban as well as the rural people in terms of bridging the gap, both in terms of time as well as the cost. This adoption of these digital technologies have reduced the cost of healthcare significantly in both urban setting and rural setting. When it comes to rural, there are number of smartphones and smartphones. Within the smartphone, there are number of apps, particularly on health. The highest number of apps for any business, if you look at it, is the healthcare apps that are the highest in the app space also. But I do not have the exact number, but my gut feeling is that there are number of highest number of apps, digital apps, are for health. And as I heard from the speakers, that more than one third of the data that is generated pertaining to healthcare. So you can see the proportion of apps also in that similar portion in terms of digital apps, which has been used by both rural and urban. I would say rural folks are using much more health apps than urban, because they have a proximity or a better access to healthcare facilities compared to rural. I see rural technology adaptation or digital health adaptation in rural seems to be, some of the areas particularly, is much higher than the urban. I can give a few examples, like south and north, particularly in India. The penetration of smartphones, though there is a state level differences, but south is far ahead of north in terms of application of these digital technologies. Sometimes I call this as a north-south gap also within the country, which is true for every other aspect also.
Right.
Be it economy, be it culture, be it innovations and anything.
Right.
So, and you see these apps or the innovative applications of these apps, if you see, the majority of them have been developed in particularly in Bangalore.
Right.
So the south one way is the hub for a lot of innovations, in particular healthcare innovations, and so as Delhi NCR. In Delhi NCR also there is a lot of innovations led by or developed by the startup companies. We have a number of startup companies in our own institute at IIM Lucknow Incubation Center.
Yes.
I know literally that number of startup companies working on this app development and making it as a viable business model.
Right.
So in future, I think the healthcare delivery is going to be dominated by the non-medical professional than the medical professional. Particularly IT professionals are going to become a kind of the major source of healthcare delivery.
Sir, as you have already answered the question that I was going to ask next, which was how telecom players and non-medical players are going to...
I'll give you my idea of what it is. If you look at today, the mobile phone companies and software developers and software companies and telecom infrastructure service providers and all, everybody is coming into health.
Right.
So I can give you a number of examples like Bharati Airtel or BSNL or other other service providers. And you also see in the health infrastructure, some of the companies which are not into health, they are also started coming into health, both in terms of digital health as well as conventional health care delivery. For example, Adani is coming into Adani Group is very heavily investing and taking over some of the hospitals.
Many corporates, Deloitte, EY, went into IT and now switched to health as well.
And just latest result on latest news on Blackstone is the sole now the current player which left with the bidding for care hospitals of Hyderabad.
Okay.
So there is a huge opportunity for making the difference in the healthcare. I think healthcare in particular in India is the future for everything, according to me.
So it
And
is
in
indeed
that
true.
digital health.
Right.
So our country it has made a national digital health mission, thanks to our political leaders, and it is going to make the difference. And the India is going to show the way for the rest of the world also.
Right. Indeed, he's true
So,
about each
and
and
of
everything
course,
he spoke.
I can go one more step ahead, that India has made its imprints all over the world in terms of IT, and now I see much more than that business world. In now health world, IT, digital health, particularly the India's capability in health in IT field is going to make India as the destination or the Makkah of digital health. It's not only health. India is going to be a Makkah of digital health.
One day that will be sure true, right? And sir, as you said, that political leaders are pushing us towards the digital health. So, could you please shed some light upon the role of government, education institutions, or health providers
Very good.
in spreading awareness?
I think it's a excellent question. We call in our business language it as triple helix model,
Right.
wherein academia, industry, and government should come together in making use of anything that you develop. Innovations is not sufficient just finding an innovation.
Right.
Innovation becomes successful only when it reaches to the grassroots level.
Right.
For example, if you see the kind of innovations that became very, very successful, it is mainly because of the awareness that has been created by various stakeholders at the grassroots level.
Right.
For example, smartphone. Nobody has said that how big is going to be the smartphone market, but people realize that the usefulness or the value that is going to be generated using these digital platforms, and then people adapted to that.
Right.
And now, if you ask what is the phone, if somebody is having a conventional phone, or let us say mechanical phone or old phone, I think I would say they are the unique. Everybody has become a smartphone holder and multiple smartphones.
Right.
So that kind of thing is going to happen once you know that what is the app that I'm going to use for different health conditions. For example, mental health apps are different.
Right.
And curative care health apps are different.
Right.
You want to reach out to somebody for a second opinion, it is different.
Right.
So there are multi-sectoral, within the health, there are multiple areas where the digital health products are penetrating very deep. I think these are all going to consolidate very soon, and it's going to become a big opportunity for everybody, including practitioners, education institutions, and government. And the government also should take steps to spread the awareness. For example, Swachh Bharat.
Right.
In Swachh Bharat, there is brand ambassadors like Amitabh Bachchan and a few other Bollywood actresses and all.
Right.
They came forward to disseminate about the Swachh Bharat Abhiyan
Right.
in this country. I can say two main very successful things I can see is one is Swachh Bharat Abhiyan, another would be a digital health mission.
Right.
If that kind of the major activities taken care is launched by Government of India and in respect to state governments and also other healthcare organizations, including education institutions, like for example IIM.
Right.
What is the role of IIM to spread this word about digital health?
Right.
There are a lot of apprehensions by these people. Whether is my records are secured. For example, today cyber attacks that are happening.
Right.
So that is where the security protocols are going to be very, very crucial.
Right.
So now everything is running, particularly India is running on one number called Aadhaar number. How do you safeguard this Aadhaar number in these health records or wherever it is connected?
Right.
So, and safety and security of these digital health records is the major concern for every stakeholder, but that has to be worked out in a larger scope.
Right.
Yes.
That is still the need of the hour.
Absolutely.
Right. So, sir,
The security of the information. Information is everything today, and security of the information is beyond information.
Right.
Yes.
Security of the information is beyond information. That's some
We call
lovely
it
words
as
you have
even,
said.
you can even say that now the people are talking about biosafety and biosecurity.
Right.
So to that level now, the new models have come up, and you have to be prepared to those areas which are not even known as of now. As you evolve, these technologies as well as the requirements of these technologies are going to evolve. Okay?
So we also hope that India will soon be
Yeah.
getting off all the things that you just said, and
Correct.
we also talked about digital health mission in between. So what do you think about the future of digital health mission in India, since it is a mission?
Critical.
It is a critical. It is a critical option right now.
Yes.
Right.
So, as I already mentioned about three things, I will quote: the awareness of the all the stakeholders and adaptation, and I would say the security is very very crucial. And how do you ensure this security? How do you win the all the players that it is safe and secure to get into the digital platforms?
Right.
Suppose if I want to share my data with my doctor,
Right.
is my doctor is trustworthy?
Right.
The very important aspect is how do you protect your data?
Right.
How do you protect your personal details?
Right.
What is the guarantee that these healthcare organizations are not going to misuse my data?
Right.
So this is where security protocols or IPR issues to do with this data. And also there are certain users of this data, not that nobody can use your data. But for research and development purpose, for developing an appropriate drug for India.
Right.
For example, now India has a specific disease profile, or
Right.
health profile of India is different from health profile of any other country.
Right.
Within India, health profile of one state is different from other state. For example, maternal mortality rates and IMR, MMR, etc. in UP is different from that of let us say Tamil Nadu.
Right.
So, what kind of targeted policies or targeted treatments or targeted uh, preventive mechanisms that would work, it all depends on the research.
Right.
So it has to go into clinical research, and you have to create that collaborative innovation. I call it as a collaborative you can progress and achieve wonderful results through collaborative innovation. In fact, we have organized a workshop in 2015 May, a collaborative innovation for healthcare delivery. So I see one of the trustworthiness of this collaboration and trustworthiness of this collaboration, and you will be working with your competitor in this collaboration. So you have to, digital is going to make or multiple competitors to come together into this, and that's where the mechanisms and policies and incentives should match with these kind of futuristic healthcare delivery models. I think the healthcare delivery model of India is going to, the futuristic healthcare delivery model of India has to be built based on digital health landscape. So that's my take on that.
So I'll summarize what Professor Venkat just said. He said that data, like getting the right data, is not the only thing. Using the data rightly
Absolutely.
should be the thing that we should focus upon.
Yes. And
Right.
also protection to this data,
Right.
so that it should not be misused.
Previous to everyone.
It should not be misused.
Mhm.
So, and you have to create the trust among all the stakeholders, and there should be a transparency mechanisms to see that it is not been or it is being used for right purpose.
So, sir, since you are from IIM Lucknow, and I just want to ask you some last words to all the young innovators listening to us. Would you like to say them something?
Okay, good. I think I would put it this way: digital innovation and young innovators. I can see in the last, this is the 5th edition of InnoHEALTH conference, and every year there is one theme. For this year, the theme is the digital health.
Right.
I could see very, very young boys and girls, and who are graduated, and those who are into PG education and so on and so forth. I think I see the future of any country in the world is in health, and that too it is in digital, and that too it is the young innovators driven digital health.
Right.
So there is a huge opportunity for young guys or young innovators to make the difference
Right.
in their lives as well as in the lives of the society at large.
Right. So those were some
The
very
future
encouraging words.
for Indian young innovators.
Yeah. So the future is Indian
Future
young
health,
innovators.
future health. I would put future health is in the hands of young innovators, and maybe you can say now already AI and ML is making its waves. I think the healthcare is going to be in the fragile hands of the young innovators.
So those were some very encouraging words coming up from Professor S. Venkat, and you could not expect anything better.
I also want to give you one insight that number of innovators among many IIMs, IITs, and other institutions are also there. I'm also happy to say that IIM Lucknow is the pioneer in having a significant number of innovators, startup founders, in particular from IIM Lucknow.
Right.
Like for example, Doc Online, and there are plenty of others.
Right.
AI Smiles.
Right.
And you will take any field in that, you will find a innovator or a startup
Right.
founder from IIM Lucknow in
Right.
particular.
Right.
And I must also tell you that the course that we are offering at IIM Lucknow on healthcare is one of the unique electives for my MBA students. And many of them are also getting a good number of placements in startups in healthcare in particular.
Right. So, sir, how do you basically push them to go and do their own startups? Because nowadays I see people are susceptible. People are not very much into startups. People are afraid of doing startups because that is a very
Good.
bold thing to do.
See, I tell you, there may be a startup founder. The startup founder alone is not sufficient.
Right.
He has to find the right mix of people.
Right.
He is able to find that right mix of people from very prestigious and unique institutions,
Diversified background.
Right. In particular, those who have this interest and good amount of skills in the software and other domain expertise.
Right.
So, and also some knowledge about business also
Right.
is very important. At
Right.
the end of the day, you have to make it viable.
Right.
I would say an MBA with a good skills and awareness in healthcare can make a much more difference.
Right.
I would strongly suggest all the founders of these in startups and even those who are working in these kind of startups, they should also have a management perspective, management inclination, or I would say management education, knowledge about management education to make the difference, because the management science ultimately brings all other sciences together.
Right.
So management is key for this, and I
just
would
knowing
even
the
put it as leadership.
Right.
Leadership.
Right.
And I would call it as the young digital innovators, and they should become good leaders in their space.
Right.
A leader in the sense, you should create teams and sustainable teams. So that's what I mean.
Right.
Yeah.
So that was all. We are signing off right now. Thank you, Professor S. Venkat, for coming up with us and sharing so good knowledge with us. We'll come back to you again the next year with even a better topic on digital health or even better digitalizations with good young innovators. Thank you for staying with us. Stay healthy.
Right. Thank you. Thank you, Himanshu.
Thank you, sir.